Hello, everyone. Welcome to our program, mental health program, which is part of our health series programs that we run here. And if you are new, we want you to understand that it is really critical to understand our mental health. A lot of people don't understand what mental health is, but mental health is one of the critical components that we really need to look after more than our jobs, more than the food that we eat, because it controls our lives. It has to do with the way we think. Mental health is a person's condition with regard to their psychological, emotional well-being, and when we are talking about psychological, psych from psychology, it has to do with the way your mind operates, and we are talking about the emotional well-being. You see, when you are affected emotionally, it means it affects even the way you operate, the way you function. So your functionality is also affected. Henceforth, it will then affect the productivity. You won't be productive. You won't be productive at the end of the day. So this is what we want to talk about here. If you are interested in this, and if you're having challenges emotionally, psychologically, this is your program. I want you to follow. Make sure you like and subscribe as we move on, so that each time when we have another program, you will be notified. So today, we are going to dive into a topic that affects millions of people worldwide, which is called sleep apnea. Sleep apnea. Now, one might be wondering, what exactly is sleep apnea? And how does it affect or impact our health? Well, you're in the right place. Let's find out. Sleep apnea is a serious sleep disorder characterized by a repeated interruption in breathing during sleep. What it simply means is these are pauses that can last anywhere from a minute, a few seconds to a minute, and they can occur dozens of times each night. This not only disrupts your sleep, but can only lead to a host of health issues if it is not treated. Now, a lot of people don't understand that this is actually a serious problem. I remember even when I was growing up, we used to talk about this, but we never saw it like a problem really, but we were actually laughing at each other, where you have challenges in breathing when you are sleeping, where you have breaks, pause, and some people, they call it snoring. Yeah, if you are a Shona person, you call it magwiriri. Magwiriri. Where when you are sleeping, you go. You see, this kind of, it's actually a mental health problem. But we did not know as we were growing up, It's actually a serious problem that really needs to be attended to, and you really need to see a doctor for that. So I'm just here to say, these are simple things that we used to experience as we're growing up, but many a time we don't really give much attention to such things. And at the end of the day, ultimately, they have side effects. They have long-term effects on our health. They have long-term effects on our health. So, let's look at this. Let's talk about these types of sleep apnea. Now, there are three types that we have. We have got obstructive sleep, then we've got central sleep, and then we've got what we call complex sleep apnea. Now, today I want to focus more on obstructive sleep apnea, or OSA, which occurs when muscles in the throat relax excessively during sleep, during a blockage of the airway. like when you're sleeping, there's something that blocks. As you try to breathe, there's something that blocks your airwaves. So at the end of the day, you struggle to breathe, like there's a break in breathing. So because of that, now you go grrr, grrr. So a lot of people, they don't realize that it's actually a mental problem. It's actually a health problem that really needs to be rectified. You really need to go and see a doctor for that. You really need to go, so that they can actually, some they can give you exercises to do, or some they can actually prescribe some treatment for that, so that at least it clears. Because if it's not treated, it amounts to a series of health problems. Some of the problems can be BP. Some of the problems can be, stress. They lead to stress. They lead to a lot of serious health challenges. But because we did not know, what can we do? So this is it blocks the airwaves. This is what we call obstructive sleep apnea. There are also central sleep apnea, which happens when your brain fails to send the right signal to the muscle that controls breathing. So you see now, it has to do with the brain. So you failing to breathe, the brain it means the brain has failed to send a signal. Now, for you to have these snoring problem, the problem is why at times you wake up. When these things begin to happen, it disturbs your sleep and you wake up. Sometimes you fail to sleep again. Sometimes you lose sleep. Sometimes there's fatigue. Sometimes so what then happens is why you wake up is because the brain will try to save you. So it will send a signal to wake you up, so that at least it saves you from breathing. Otherwise you die. So why you wake up is because it disturbs your sleep. All of a sudden, when you start snoring, you go for some minutes, and all of a sudden you wake up. Oh, you wake up. Yeah, you wake up. Why? Because the brain will send a signal to wake you up, so that it saves you, because you'll be having difficulty from breathing. Now, when it's now central sleep apnea, now the brain now fails. It is now the brain that fails to send a signal to the muscles that controls what? Breathing. So you starve. You're like starving, and you struggle to breathe. You get what I'm saying? So lastly, we have what we call complex sleep apnea syndrome, which is a combination of both. Now, when you're having both the obstructive and the central, we call this now the complex sleep apnea. Now, when sometimes you're like suffocating. You're like suffocating, because when we're talking about central, it's like you gasp for breathing. You gasp for breathing, where you take a long breath. So you see, you struggle to sleep. You take a big breath. Why? Because you're struggling to breathe. So when you've got both symptoms now, that's when we have this thing. Do you know that an estimated of about 22 million Americans, they suffer from this sleep apnea? It can affect anyone, but certainly factors increases risk, such as obesity, age, and family history. Family history of where there are some people who had this disorder. So one of the things that we need to understand is age is a prime factor. Obesity, like when you're strong, this normally happens when you're strong. So when the solution will be to exercise, to make sure you reduce your weight, because if you don't reduce your weight, you are definitely going to suffer from this, where you struggle. So you see, big people, they struggle to breathe. Why? Because they suffer from this. They suffer from this because of obesity. So sometimes it can be hereditary. So symptoms can include loud snoring, gasping for air during sleep, excessive daylight sleepiness, like you sleep during the day. You go into a combi, you sleep. You go into a lecture, before the lecture finishes, you sleep. All these kind of sicknesses or difficult in concentrating. It's a mental health issue. So you go into a combi, you sleep. You go anywhere, you can't concentrate and you start to sleep. It's a mental health disorder, and this is what we call sleep apnea. This is what we call sleep apnea. So sometimes maybe you did not know. You were seeing these signs, but you did not know what's going on. I've just given you this information. So what you need to do now is to go and see your doctor, so that the doctor can prescribe some can give you exercises, some they can give you treatment to help you to clear your pathway. Some they can actually prescribe that you go for an operation so that they remove this thing that blocks your airway so that you can breathe well. So it all depends, but we advise that you see your doctor so that at least the doctor can help you to see the best way out for you, depending on the nature of your problem. That is, if you do not take too much time. Sometimes it's ignorance, but we need really to educate. That's why this program is very, very, very important, to bring information that is critical to us for decision making. Sometimes it's out of ignorance, because like what I was saying, we did not know that snoring is actually a mental health problem. We did not know when we were growing up. We did not know. Nobody told us this. But this is information that is coming now, because we didn't have people who are highly educated to help us to understand that it has to do with our mental health. So now imagine trying to sleep only to be jolted awake repeatedly. You try to sleep and you are jolted repeatedly, not realizing that your body is struggling to breathe. So this can lead to significant fatigue and even mood changes. So you see, at the end of the day, there are a lot of people who say, oh, I can't sleep. I can't sleep. I can't sleep. I can't sleep. They actually don't know that it's actually a mental condition. So whatever happens is, when this thing comes, when the brain fails to send this signal, you lose your sleep and you wake up. Sometimes you wake up in the middle of the night and you can't go back to sleep again. Sometimes you wake up more oftenly to go and urinate. It's also a sign, you see, all these kind of things. So sometimes we just take them lightly, because we just think, it's a condition, or we think these are just normal things that happens naturally, but we don't know that it's actually a condition that really needs medical attention. It's a mental health problem. So we need really to understand these things. So what can be done? The question is, what can be done about it? The good news is that sleep apnea is treatable. It is treatable. So the first thing is to consult with health professionals who may recommend a sleep study to diagnose the condition accurately. Sometimes you need to see your doctor, you need to see a health professional. They can help you to, like I said, some they can give you some exercises to do, some they can give you a treatment that can help you. Common treatments include what we call PAP. Some they say CPAP or PAP machines, which can provide continuous airflow to keep airways during sleep. And lifestyle changes such as weight loss or quitting smoking can also make significant difference. In some cases, surgery may be an option to remove tissues blocking the airways. So number one, you need to make sure, like I said, it's caused normally by age or obesity. So what you need to do is to reduce. You can either do some exercises to reduce your weight, or it has to do with the age, or it can be hereditary. So you can help yourself with any. That's why I say now the doctor might be able to prescribe the best option for you. Now, here are some few tips for managing sleep apnea. Number 1, maintain health weight. Number 2, sleep on your side instead of your back. Sleep on your side instead of your back. Don't sleep on your back, but sleep on your side. It helps you to clear that pathway, that airwave, so that there's no blockage. So don't sleep like on your back, because you sleep on your back is you go, you see. But if you sleep like on your side, it helps you to breathe normally. It helps you to breathe normally. And number 3, avoid alcohol or sedatives before bedtime. Avoid alcohol. Alcohol is one of the factors. Like I said, if you quit smoking, alcohol, it helps you to clear your path. Then number 4, establish a regular sleep schedule. Have a regular sleep schedule. Remember, if you suspect you or your loved one may have sleep apnea, don't hesitate to seek medical advice. Get proper diagnosis and treatment. This can drastically improve the quality of your life. Sleep is essential for overall health. Everyone deserved a good night's rest. But then, if you have a mental challenge like this, sleep apnea, what then happens? You will not be able to sleep. It disturbs your sleep, because each time when you want to sleep, it will wake you up. Because the moment you start to struggle to breathe, you wake up, the brain will send a signal to wake you up, to save you. And at the end of the day, you won't be able to sleep again. Or even if you sleep again, it happens again, and you will wake up. So it disturbs the flow of your sweet night's rest. At the end of the day, it's actually a problem that if it persists, it leads to serious health challenges. So this is what we have for this program. If you've got any contribution that you have, write on the box so that we'll be able to help you next time. Remember, if you read the Bible, Romans chapter 12, verse 2, it says, "Be ye renewed in your mind." Now, if you want peace of mind, you need Jesus in your life, the Prince of Peace. You need the Word of God that renews your mind. And your mind is renewed. You've got what we call peace of mind. And when you've got a peace of mind, what happens? You reduce things like stress. You reduce things like depression. You reduce all these kind of things that affect the way you function, the way your brain function. They put pressure to your brain, so that the brain will put pressure in your blood, and you have blood pressure. So, when you have Jesus, especially for those who go to church, I'm telling you, this can help you in a very big way. It can help you in a very big way. Why? Because when you've got the peace of mind, it means your mind can function normally. You are not worried by things. You are not terrified by things. And at the end of the day, you live a healthy, normal life. Because when you don't have Jesus, your mind is pressured by the day load of life. And at the end of the day, that can affect the functionality of your brain. And that then lead to a mental health problem. That then lead to many mental, it affects your wellness. It affects your mental wellness. So you'll be affected psychologically, and you'll be affected mentally. So I'm here to tell you, if you go to church, make sure you are a devoted Christian, accept Jesus Christ, and it can help you in a very big way to overcome these kind of problems. God bless you. Until we meet again, if you've got anything, we will respond to you. Just write a message on the comment box so that we'll react when we see it. God bless you.